Hello, I'm Professor Peter Barnes, Head of Respiratory Medicine at Imperial College London and Consultant Physician at the Royal Brompton Hospital in London. Asthma is an extremely common condition that is most obviously shown by wheezing and shortness of breath, and is due to narrowing of the air tubes so that patients are feeling uncomfortable because the air tubes are constricted and they feel they can't get enough breath.
Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves.
Unfortunately, there's no cure for asthma, but the vast majority of patients can be controlled for most of the time using currently available treatments. There are two types of treatment. The first kind is called relievers that relieve symptoms, but the most important treatments are called controllers, and these control the underlying disease. And by far the most effective controllers that we have are inhaled steroids. Inhaled steroids are very safe and very effective and have revolutionized the management of asthma. For some patients, we now give steroids in combination with a long-acting reliever, and this combination is very effective. Many patients are worried about having side effects of taking steroids, but the doses that we need to use for most people are actually very low and are not causing any long-term problems. Asthma seems to be increasing throughout the world, in every country, and it seems to be linked to westernization of countries. So something about the Western lifestyle is associated with this increased amount of asthma. And the sort of factors that may be important are changes in diet with less fresh fruit, for example, air pollution, and the fact that people are less likely to have infections during childhood, because infections in early childhood seem to give you a protective immune system against asthma. So probably it's a combination of all of these factors.